Good evening, everyone, and welcome to our cholesterol and your health talk. We have Dr. Udani here today, and she is going to walk us through some of the information that Dr. Jocker has in his article called Cholesterol. What is it, and what are healthy levels? And it's an article that is online. You can use the reference at the bottom of each slide if you want to see the original article and all of the details. So we realize that there could be lots of questions as you go through this presentation, and Dr. Udani is here to help, and she's here to answer all of those questions. And feel free to text her, 416-525-4850. So we are so happy to have Dr. Udani here today. So she is our licensed naturopathic doctor here at Justine Blaney Wellness Center. She is certified with the College of Naturopathic of Ontario. And I wanted to share that she has some really great special interests in women's health, chronic pain, stress that we can all relate to right now, skin conditions, and about our digestion. She's actually made such a positive impact in my life. Just the first few times seeing her, and it's been amazing working with her. She has a philosophy that she genuinely believes that everyone has the ability to make healthy and long-lasting changes. Please help me welcome Dr. Udani.
Hello, everyone. Good evening. So before we get on to the topic today, let's talk about some of our upcoming webinars. So we have a jam-packed month ahead for you, and for the foreseeable future. So we got nutrition for your heart health with Dr. Justine, and next upcoming is stress resilience. So I'm sure a lot of you are feeling a little bit of stress during this time. So this is going to be a great talk to listen into or tune into. And then exercise for kids for March break. And then we're going to also do some healthy baking for kids and talk a little bit about abdominal bloating and passing gas and what that could mean in terms of your health. So these are some exciting things that are coming up. So let's dive into today's topic. Cholesterol, what is it, and what are healthy levels? So this is from Dr. Jocker's article. So it is a free article. You are welcome to go to search it on his website. It's a lot of information there. So cholesterol, tends to get a little bit of a bad rep still. And if you think about what cholesterol is, it is a waxy substance, okay? And, it's important for proper functioning in our bodies, but it's when it's a little bit too high that it gets this bad rep because, it's correlated with coronary heart disease, increased risk of plaque formation. And so we're going to go deeper into what are some good cholesterol and what are some bad cholesterol in this talk. So, like I said before, cholesterol is important for our body. When we have the right amount of cholesterol, it really helps our body function better. So, cholesterol, think of it as a building block for a lot of things, a lot of hormones in our body. For example, testosterone and estrogen, progesterone, all of these hormones that we need for our mood, our libido, our energy. They're all made from cholesterol. Same with bile. So if you think about bile, we need bile to break down fats. So cholesterol is an integral part of what makes up bile. And same with vitamin D. So cholesterol is important for making vitamin D as well. And of course, cholesterol makes up the cell layer. So the membrane, that surrounds the cell, that protects it from others and that acts as a messenger. So point to take home is cholesterol is a very important part of our physiology and our health as well. So let's talk about the good cholesterol and the bad cholesterol. So high level, so there's two different kinds of cholesterol, okay? So there's LDL, which is called low density lipoprotein, and HDL, which is high density lipoprotein. So the bad cholesterol in general tends to be the LDL. So LDL, when they're high, it's associated with higher risk of heart disease. And that's why we need to have high HDL, the happy cholesterol, for example, because it helps kind of balance out this bad LDL cholesterol, and it also helps to kind of sweep away the LDL, like you can see in that picture. HDL helps to sweep the LDL away from our arteries and keeping it blocked free from blocks. So now, even in LDL, if you go deeper into LDL, there's good LDL and there's bad LDL. So the large LDL particles tend to be a little bit healthier, okay? And the most worrying particles are the small LDL particles. So these are the tiny ones, and these are the real bad cholesterol. So why are these really, really tiny ones bad? You think maybe the big ones are bad because they're more likely to block your arteries. So what the scientists have found is that the LDL, the smallest LDL particles, and their pattern is called B, so pattern B. And think of pattern B, B stands for bad, okay? So these very small particles tend to actually burrow deeper into the blood vessels, okay? And they can get stored in there, and over time, they create a lot of inflammation. And with this inflammation, what happens is, red blood cells, they start to get activated, there's a panic, and then platelets come in, and what happens in the end is a plaque starts to form. So the basis of this is this very small LDL particles that are coming in. And they usually tend to have less vitamin E. So vitamin E is a very amazing potent antioxidant in the body. And then they're also shown to be correlated with high insulin. So if you think about insulin, that is, there's a lot of insulin resistance in people with diabetes or pre-diabetes. So all of this kind of creates this perfect storm for plaque creation. So when we look at LDL, you got to look at the small LDL and how much you have of that. And if it's pattern B, then okay, this is not going the best way. So that's the bad LDL. So if you think about HDL, why it's good is it's made out of cholesterol, but it has a different ratio compared to LDL, okay? So HDL tends to be more anti-inflammatory. It is more of an antioxidant. It stops any clots from forming. It's an anticoagulant. And it helps to sweep off any of that bad, very small LDL particles in the arteries. So these are some of the optimal ranges for your lipid profile. So keep in mind that this is more of a ranges from US units. So if you're really wanting to know about your own units and of your own numbers, I highly recommend speaking to a naturopathic doctor or your medical doctor to see where you are in this range. And we're going to talk a little bit about some things that can increase some of these cholesterol markers and why that could be. But overall, what we want is a higher HDL to LDL ratio, because then we know, okay, you have a higher of the good cholesterol compared to the bad low LDL cholesterol levels. And of course, you want to make sure you check out the triglyceride levels too. So that's another form of fat that we want to keep an eye on as well. So factors that cause poor cholesterol and lipid ratio. So these are some of the factors that might make you see when you look at the blood work, you see, oh, my cholesterol is too high, my triglycerides are too high, my HDL is too low. So poor diet, 100% when you're eating fatty foods, lots of processed meats and things like that, it's going to increase your bad cholesterol. Sedentary lifestyle, when you're not exercising, when we're sitting, working in our computer, working from home all the time, we're not moving our body, we're not having that circulation. And that gives time for the cholesterol or these particles to deposit in our vessels. So we got to make sure we're moving. We got to make sure we're moving, even if it's for a little bit, every day, just every hour, making sure you're getting off the chair and doing a little bit of an exercise routine. Chronic stress is another huge impact that has an impact on increasing your cholesterol. Insulin resistance, so like I mentioned before, insulin resistance has shown to increase that very low LDL, so the very bad LDL, high cholesterol. Hypothyroidism, if you have hypothyroidism, so low thyroid hormones, that's also shown to increase cholesterol in the blood. Okay, poor sleep or having sleep apnea, sluggish liver, so liver is not able to digest and detox these cholesterols in the proper way. And smoking increases risk factors for almost all conditions as well. So there's some things that can cause poor cholesterol and lipid ratios. So top foods and ingredients that promote inflammation. So these are the things that those bad guys that we all know. It's the sugar, the high sugar, high processed foods, the conventionally raised meats and dairy. So those are, maybe they're not free range. They're produced in the farm. They're grain fed. Farm-raised fish and seafood, those tend to have a lower nutrient profile, so less diversity in their nutrients and minerals. Processed meats full of nitrates and a lot of chemicals, synthetic chemicals, trans fats, food additives, and even things like food dyes, made out of synthetic chemicals. Gluten for a lot of people these days is a sensitizing factor in their digestion as well. So these are some of the foods that can promote inflammation, and when there's inflammation, there's going to be cholesterol there. Trying to it's going to add more to that inflammatory process. So benefits of movement. So like I mentioned before, it improves circulation. We want to have good circulation going on so that HDL gets to where it is needed and helps flush out the bad cholesterol. It stimulates lymphatic drainage. It helps with any kind of water retention. It balances key neurotransmitters, so you feel happier when you're walking. You feel your mood is more uplifted. Movement, so could be even just a little bit of a walk or a little bit of a quick run or just some strength training, and it can improve your mood, happiness, and enhance your mental clarity and memory. So these are some amazing benefits of movement, and that's why I always recommend you, when you're in the computer, just even for 10 minutes or 5 minutes, just get out of your chair and get a little bit of exercise routine so that you're not just sitting down, for 8-10 hours. Yes, so recognizing symptoms of stress. So stress can be really bad on the body. It just wears and tears on the body. This is long-term stress. So chronic stress is that causes a lot of illnesses, a lot of diseases in the long term. So what are some symptoms of stress? So I always say whenever you're feeling a little bit stressed, just kind of tune into your body and see where there's tension. So for example, a lot of people have tension in their jaw, or they hold a lot of tension in the jaw and also in the shoulders, or you might get some back pain, so some tension in the back. And then there's also, if you think about your mood, are you finding you're very irritable? Are you just lashing out at your family, your kids? Are you having trouble with sleep? Are you, staying up at night? Is your digestion off? Are you feeling bloated with all the, even whatever you eat, you get bloated? So these are some things to kind of tune into your body and see where am I holding some tension, what just doesn't feel like it's good, And so that's how you might be stressed. And this is a way your body's telling you, okay, this is how I'm stressed and I need to take some time for myself to reduce my stress. And because, over time, this chronic stress is really bad on your heart, especially blood pressure, for your lungs, because your breathing is more shallow, so you're not getting as much oxygen. For your joints, the inflammation affects your joints, arthritis, your kidneys. So these are a lot of bad effects with chronic stress that we want to watch out for. Signs of insulin resistance. So usually with insulin resistance, that can proceed for up to years before you develop diabetes, okay? So insulin resistance is when insulin is trying its best to control your blood sugar and your pancreas keeps pumping more and more and more insulin out, and it gets the job done, but your pancreas is more and more stressed because more and more insulin is needed to control the blood sugar, whereas before you needed a little bit of insulin to control it the same way. So what are some signs? So you tend to have trouble with weight. So you tend to be more overweight, trouble with losing weight as well. You tend to have a very large appetite and craving lots of sweets after meals, or you don't feel satisfied with the meal you eat. In a couple of hours, you're like, I'm hungry again, I want to eat. Frequent feeling thirst and urination, because now that insulin resistance is affecting the liver and how it's working. And, for females, we have, there's tend to be a lot of testosterone dominance. So PCOS picture, if you heard of that condition, that's where a lot of females get hair loss. They get hair growth in areas, like chin and chest, and acne on the jaw. Those are all signs of hidden insulin resistance. And high blood pressure and high fats is also another sign. So thyroid hormone and its effect on lipid metabolism. So a lot of patients that come see me that have trouble with weight tend to have lower underactive thyroid. And when your thyroid is underactive, you tend to be in a more hypothyroid state, okay? So a hypothyroid state is, you're just tired, you're tired, you have poor memory, you're fatigued, you tend to gain weight, you feel bloated. You actually had a patient recently, where, you wake up and you just look at bread and it feels like you gained weight. So that could be a sign of low thyroid as well, because thyroid controls your metabolism and your metabolic rate. So how thyroid affects your cholesterol is the thyroid hormones actually help cholesterol be shuttled into the cells. So it helps the cholesterol not stay in the bloodstream for too long. So when you have an underactive thyroid, you have low thyroid hormones kind of floating and circulating. So that means there's more of this cholesterol in the bloodstream compared to it being in the cells. So let's talk a little bit more about food sensitivities versus food allergies, because this is also important when we think about inflammation. So food allergies, you usually happen from infancy, okay? So these are things that are, when you did allergy test, it came up with a positive, okay, you're allergic to these things. And they tend to usually develop, things like trouble breathing or hives, but they're very immediate. So within 2 hours or less of eating a certain food, you get this. And, this, so most common types of allergies tend to be, nuts or milks, certain kinds of milks, for example, nut milk, for example. And sometimes fish too, like shellfish and things like that. So, and how to differentiate between allergy to food and a sensitivity to food is food sensitivities can happen at any age, and it's usually more delayed. So you don't get this immediate reaction that, oh my God, I ate something and now I feel like it's hard for me to breathe. Usually food sensitivities develop as bloating or brain fog, or, they feel tired, you might get eczema and joint pain. And this is not emergency, but it's definitely not, good for your life, right? Because your quality of life is reduced. And there's a lot of sensitivity to gluten, like I mentioned. A lot of people have dairy sensitivities, things to sensitivities, eggs as well. So it can be multiple food sensitivities. And that's why you need, in order to figure it out, you can do IgG food testing, or there is, a variety of testings we can do to determine what kind of food sensitivities you have. So I recommend coming in to see a naturopath or a nutritionist to see what kind of testing can be done, and also what are the most common foods that trigger food sensitivities. So sunlight deficiency and blood cholesterol level. So like I mentioned earlier in the talk, cholesterol produces so many amazing hormones and chemicals and minerals for our body. And one of them is, cholesterol can be produced by this precursor called squalene. Okay, so squalene in the skin can either be turned into vitamin D or cholesterol, like pure cholesterol. So if we don't have enough sunlight, what happens is that squalene gets converted almost all into cholesterol instead of vitamin D. So what that means is Going outside, being in the sun is so important because now you're getting more vitamin D, and you are into converting a lot of it into cholesterol. You're keeping that squalene into converting into vitamin D. And so this is why it's important to get lots of sunlight exposure whenever you can. And, especially in the wintertime, I know this could be really hard. So that's why just always make an extra effort to do that as well. Yeah, so when vitamin D is produced, so you get a form of vitamin D from the skin, but it needs to go through your liver and your kidney first to become the active vitamin D that our body needs. So it's a whole process, So you're exposed to sunlight, and then that chemical molecule gets through your liver and your kidney in order to be active, an activated form of vitamin D. So sleep apnea. So do you have sleep apnea? So these are some risk factors. So family history, being overweight, having a thicker neck, so more pressure while you're trying to breathe, the older age. You can have an enlarged tongue, so more for that blockage or tonsils. And what happens with sleep apnea is you're not getting that oxygenation you need, and you tend to feel so much tired, and you're wondering, and some of the symptoms here, you wake up gasping for air, there's a lot of snoring, you get the headache in the morning because your brain wasn't getting enough oxygen, right? So there's a little bit of inflammation going there, sore throat because the throat is super dry, and this can cause a lot of hypertension, so blood pressure issues, stroke, heart failure, depression, and even motor accidents because you're fatigued, so you can't focus. So these are some things to really consider to see if you do have sleep apnea, because overall this is going to increase that inflammation and stress in the body. And what are some functions of the liver? Because when we think about cholesterol is produced predominantly in the liver. So liver think of it as the transportation headquarters for cholesterol. It's produced there, and it also it determines where it is transported into the body. And liver, when you think about it, is such an amazing organ because it detoxes medications, it detoxes hormones, alcohol. All the food that we eat first needs to go through the liver too. It really is this transportation headquarters, in my mind. It just goes everywhere. So it's so important for metabolism. It's so important for digestion and detoxing as well. And, the liver, one of the amazing things about the liver is even if it's a little bit damaged, it can regenerate if given the right nutrients, right diet, and right lifestyle. And a lot of people that have high cholesterol also tends to have something called a fatty liver, because when the liver isn't able to work properly, that cholesterol that it was trying to move out of it ends up getting stored in the liver. So this also happens with high alcohol use as well, because it takes a lot for the liver to detox the alcohol and metabolize it, right? So it tends to be a little bit more tired and sluggish and not work as well. And over time, it tends to get these fat deposits and storages. So what are some strategies to improve cholesterol and lipid ratio? So making sure that is number one, having that anti-inflammatory nutrition plan, trying intermittent fasting, having that movement, exercising regularly, supporting your thyroid, finding ways to reduce your stress, and getting that optimal sun exposure so you get more of that vitamin D, optimizing sleep habits, right? If you have sleep apnea or symptoms of that, going to see your healthcare practitioner to see what can be done about that, and supporting the liver health and the bile flow, because liver also makes sure that enough fat is metabolized and broken down. So what are some of the top anti-inflammatory foods? So these are think about it as if it was made from the earth, and if it had as little human interaction, human impact on it, then that is probably a good food for you. So that's anti-inflammatory. So things like wild caught salmon, or olive oil, extra virgin olive oil, avocado oil, lots of leafy greens, coconut oil, spices, things like thyme, rosemary, turmeric, clove, peppers, ginger, very anti-inflammatory. And, if you want a good protein source, I always say grass-fed beef. And, try to get more of that in your diet compared to the pro-inflammatory foods that are processed and full of that starchy white grains and, lots of sugar. So what are some of the good fats versus bad fats? So even with fats, think about it, if it was made as naturally as possible from a natural source, and it contains, it's, non-GMO, it is from a good source. So like, grass-fed butter is better than the regular butter, right? Because it contains more minerals and vitamins that you need. Things like tallow, ghee, avocado oil, olive oil, fish oil, these contain more of that anti-inflammatory fats and that we need when we're fighting cholesterol, high cholesterol, have that bad cholesterol. So trying to stay away from the bad kind of fats, so things like soybean oil, corn oil, grapeseed, margarine. So these tend to have a higher ratio of the inflammatory fats. So that's why, they are considered bad, because we don't want a lot of that in our bodies. So top 12 benefits of a fasting lifestyle. So if you ever try intermittent fasting, it is a great way to kind of reset your body, to tell it that this is time to reduce inflammation. It shows that you can improve your energy levels, can also be great for burning fat as well. And it really does, it improves your aging markers actually, because, when you are, when you practice in this lifestyle of intermittent fasting, you're telling your body to be like, hey, be more efficient. So because we're not giving you as much energy, or this time period. So what our body does is it kind of shakes itself off and tries to make sure, okay, any of the cells that are not working better are working fine. Okay, let's slowly get rid of them, so that only the best and the most efficiently working cells are there. And so that really helps decrease that overall inflammation. And high intensity interval and resistance training benefits. So doing something that is a high intensity interval resistant training can be really great for fat loss and fat burning. And this stimulates your energy centers, your mitochondria to produce more energy. You can improve your breathing and the sweating. So more sweat you have, more of a detoxing effect it has on the body. It's detoxing a lot of the toxins out. And it is great for enhancing your metabolic rate as well. So with any kind of exercise plan and a diet plan, I always recommend coming to see a naturopath or even your Maximize Living chiropractor, just Dr. Justine, because we can guide you into seeing what is best for you at your stage where you're right now. Because a plan that's good for someone that is 35, it might not be good for someone that's going through menopause, and they're over 40 or 50, right? So we got to make sure it's individualized to you, and so it's going to give you the best results possible. So food sensitivity symptoms. So I always say the first symptom to look out for is bloating after eating that certain food. If you experience bloating or constipation or diarrhea, then you're most likely sensitive to this food. Some of the more long-term symptoms of this food sensitivity is things like skin issues, so eczema or acne, brain fog, a lot of fatigue, a lot of memory loss, joint pain are some of the symptoms as well. And so I would say those are some of the key symptoms to look out for to see if you are sensitive to certain foods. So some symptoms of hypothyroid. So like I mentioned before, you need a properly acting thyroid organ to control your cholesterol. So, and of course, thyroid hormone is so widely used in the whole body. So some of the symptoms of hypothyroidism, so an underactive thyroid, is you tend to get heat, hot, cold intolerance. So you feel cold hands and feet. You tend to sometimes have thinning hair, a lot of tiredness, a lot of bloating or fluid retention, brittle nails. You might even tend to get, dry skin, weight gain. Constipation is another key factor for hypothyroid symptoms. So these are things, if you're experiencing this, don't wait. You should get blood work done. You can come and see a naturopathic doctor, or your medical doctor and ask to see if you can get the full thyroid picture done. That way you know, okay, where are you in terms of a hypothyroid picture. And oxygen is amazing. It's one of the most essential nutrients. You know, when we're stressed, we tend to breathe more shallowly and we tend to breathe more often. And that is actually not optimal because we're not using the full muscles of the lungs, and you know, we're not getting that full breath in. So making sure that's another symptom of high stress is that shallow breathing. So you are having that deep breath, or you can take a deep breath in, count to 4, and exhale. And practicing something like this can be really great to reduce stress and also get that oxygen into your body. And sunlight improving brain function, you know, it sends signals to the brain saying, this is the time to be active and working and, you know, being more. And because we're now exposed to so much artificial light, it's so important to kind of go outside and get the sunlight as well to have that best brain function. Because sometimes our brains get confused when there's too much blue light coming from the screen. That can affect our sleep as well. So I always say when we are getting closer to bedtime, making sure you're not on your computer for too long, or you wear something like blue light blocking glasses, for example. That can be really amazing for kind of rewiring your brain to get ready for bed. Yeah, so speaking of sleep, these are some tips for a great night's sleep, you know? Making sure, so sometimes keeping your room cool, even things like that, because, you know, when you're a little bit cooler, we tend to be able to relax more and sleep better. You know, we can even have a sleeping mask. So like I said, to kind of further cancel out any of that blue light in the system, avoiding caffeine. So I would even say, stop drinking coffee at 3 p.m. if you want to have a good night's rest. Things like even working, exercising, don't exercise too late into the night because that's going to excite your body and you're going to get all these endorphins that makes you excited and feel good, but it won't help you relax. And avoiding bright light. So things like your cell phone screen and your computer screen can really, really mess up the circadian rhythm and the brain. So there's some of the detox pathways in the liver. These are some things to really speak to a naturopathic doctor about, because, you know, there's so many steps that the liver has that goes through with helping with detoxification of cholesterol, of toxins, of medicines, and things like that. So, and if you look at, for example, step 1, you know, there's B vitamins, glutathione, folate, and all these things. So come in and speak to a professional to see how much of each you would need, or if you would need them at all. Because if you're getting it from the diet, then you're not necessarily needing it. On the same hand, if you have symptoms of, you know, sluggish liver or weight gain and low thyroid, then definitely come in to check these out, because you want to make sure if you're deficient in these or not. So comprehensive blood analysis, like I said, you know, as naturopathic doctors, we do blood work, and I 100% stand behind doing blood work, especially with cholesterol. If you want to know your numbers, I always say get that baseline, because that way we can see what we need to do to get you back to feeling your best and getting those numbers back to in the normal range. So this should be run, you know, I would say at least once a year, especially if you are at risk for diabetes or high cholesterol, stroke, and, you know, things like even hypothyroid, just so that we know where you're standing and what things we can do. So that comes to the end of the talk. So it was a lot of information. Thank you for, you know, tuning in and staying with your attention span and everything. So we have some amazing talks that are coming up as well. So we got nutrition for your heart health with Dr. Justine. We have stress resilience, so 12 strategies to grow stronger with myself. We got some exercise for kids for March break, and some healthy baking for kids as well. And a talk on embarrassing abdominal bloating and passing gas, and what that could mean for you and your digestive health. So stay tuned, and this will be done every week. And we always love to hear your feedback and, you know, your reviews, as well as just your even ideas that you want to talk to us about. We'd love to hear all of that as well.
So thank you so much, Dr. Udani, for being here with us tonight and really walking us through what cholesterol looks like and that it's not all bad, but we really need to understand what it is and how all of the different lifestyle aspects really can impact us. Thank you so much for being here with us.
Thank you so much. Have a great night, everybody.
Good night.